Causes of death from wound: immediate or direct causes, remote causes, death after varying period from time of injury. First is hemorrhage, may be internal or external, may occur at the time of injury, primary or after several hours, secondary. Sudden loss of blood is more dangerous than a gradual loss of same quantity of blood. Rapid loss, more than 1/3 of the blood causes death. A loss of even small quantity can result in death in women, children and old people. People with coagulopathies, minor trauma is enough for massive hemorrhage. Reflex vagal inhibition causes sudden death with no external signs of injury. Shock, circulatory disturbances characterized by an acute persisting reduction of blood flow to the organ. Classification: primary or neurogenic, from a sudden reduction of a venous return to the heart due to neurogenic vasodilation with a peripheral pooling of blood, especially in a splanchnic area. Secondary or latent shock is more serious and fatal as there is progressive circulatory failure and damage to tissue. Types: hemorrhagic shock, when blood loss 10 to 40% is sufficient to impair peripheral perfusion. So, shock, reflex vagal inhibition, hemorrhage, that is immediate direct causes. Then trauma or a wound shock, when there is loss of blood or plasma or both from ruptured vessels. Burn shock results from loss of plasma, absorption of necrotic tissue and bacterial sepsis. Surgical shock occurs either during or immediately after surgical procedure due to anesthesia, loss of blood or plasma, emotion reaction, infection. Cardiac or cardiogenic shock result from decreased cardiac output, reduced blood flow and deficient oxygen delivery to tissue. Septic shock develop in presence of infection. Endotoxic shock seen in patients with gram-negative bacterial infection. Mechanical injury to the vital organ. Severe injury to a vital organ can cause death. Crushing of heart or brain. Slightest injury to previously diseased organ is also fatal. Rupture of enlarged spleen. Then the remote causes: death after varying period after time of injury. Infection: wound infection may be caused by organism normally present on body surface like streptococcus, staphylococcus, coliform. Organism invading tissue from involvement like staphylococcus, clostridia. Primary infection is caused by organism entering wound at the time of injury from skin and cloth. Secondary infection is caused by organism invading wound after injury through airborne droplet and contaminated dressing. Gangrene or necrosis results from severe crushing or part of tearing of the blood vessel. Crush syndrome: severe crushing of muscles, especially lower limb, causes necrosis of muscles due to ischemia of direct compression and producing traumatic tubular necrosis. In such cases, death follows in a week after injury. Neglect of injured person, bad treatment or negligence by doctor or relatives or disobedience on part of patient can lead to complication and even death. Surgical operation: if a person dies during or after surgical operation performed for treatment of an injury, then assailant is held responsible for death. However, it should be proved that operation was must to save life and was performed by a competent surgeon with reasonable care and skill. But if injury is not fatal, if proved that victim's death occurred due to application of harmful medicines, then it does not amount to homicide. Natural disease: in some people, cause of death can be precipitation of underlying natural disease like a fatty degeneration and heart, etc. Remote causes and death after varying period after time of injury. Next is supervention of a disease from a traumatic lesion. A fibrous scar tissue formed due to healing may contract and produce complication. A bullet may cause structured aneurysm. An abdominal injury can produce strangulated hernia at a later date. Thrombosis and embolism. Thrombus develop within 10 to 20 days, may dislodge producing embolism. The most common sites are deep femoral, popliteal, femoral, posterior tibial vein and usually follow traumatic lesions of the lower limb. This embolism may cause infarction, any vital organ leading to death. Fat embolism may occur in fracture of long bones, especially femur, injury to adipose tissue, forcing liquid fat into the damaged blood vessels, injection of oil into circulation as in criminal abortion, occasional natural disease without trauma in sickle cell anemia. Air embolism can sudden death due to pulmonary infection. About 100 ml of air introduced under pressure is necessary to produce fatal pulmonary embolism. Causes: incised wound of lower cervical or clavicular region involving jugular or subclavian vein. A wound of superior longitudinal sinus inside the skull. Crush injuries of chest. Faulty technique in giving IV injection with the gravity apparatus. Artificial pneumothorax and pneumoperitoneum. Injection of air under pressure in uterine tube to test its patency. cesarean section version or manual extraction of the placenta, injection of air or fluid mixed with soap or water into the pregnant uterus, and the Caisson's disease. Medico-legal importance. The cause of death from injury is paramount in deciding culpability of an assailant. For example, if blow to abdomen causes death due to hemorrhage from rupture of a diseased spleen which assailant was unaware, then it amounts to culpable homicide not amounting to murder. If a victim succumbs to his injury due to remote causes, still makes assailant culpable for his action. Thank you.